Important role of cognition in any kind of instances relating to sexuality. What about sexual orientation? Whenever you are going to try and combine the two, the behavioral point of view and...
Good morning. It is, first, let me tell you, it's a pleasure to be here. And I thank to Andrea Salonia, Silvia Mizit, and all others from IBSA Foundation for inviting me. It's a great pleasure. It's always also great to be in Italy. People coming from Portugal, we have that kind of south sense of Europe, so we are, in a sense, brothers also, Latin language and so forth. So it's great to be here. Thank you very much. This is actually also a very honored situation because I'm surrounded by experts in the field in several areas, so thank you again. So what I'm going to actually talk a little bit, I will try to be relatively fast, is relationship between mind, body, and sexual response. And actually also the main question, so the first question is, what is really a sexual response? What is sexual arousal? How do we measure sexual arousal? And I'm going to talk not about rats, but about men and women, so human. So is that sexual response something which is related to the body? Of course it's related to the body. There's a physiological component on it. We can measure it. I'm going to show it how we do it in our lab in Portugal. But it's also a subjective response. So it's related to emotions. It's related to cognitions. And we actually reported our pleasure, our subjective arousal, how do we feel our emotions. So is this both come together? In other words, is the body always interrelated with the mind? Is there always concordance between the body and the mind when it comes to sexual arousal, sexual response? So we know from, actually also from Alfred Kinsey, who had some experiences watching and reporting directly on sexual behaviors and sexual response, but mostly from Masters and Johnson that we know, the physiological aspects related to sexual response in men and women. But as most of you may know, Masters and Johnson used mostly, physiological correlates of sexual arousal. So they were mainly focused on physiological response. David Barlow, for instance, is a quite known clinical psychologist from Boston University, who I had the privilege to work with back in 2000. He started actually researching and in his lab the interrelation between thoughts, emotions, cognitive process, and sexual response at the same time. So he's not actually looking for the physiological response, but the relation between psychological aspects, cognitive aspects, and sexual response in the way they interact with each other. And also, I would call it the new generation. They're not so, actually not that new so much right now, but Eric Hansen, Alan Land, Meredith Chivers, Cindy Mess, and so forth, they actually had a lot of research in the lab with men and women. So, of course, we can do research in the lab with men and women, although there's, of course, the ecological validity in those. But what I wanted to say is that since Masters and Johnson, we know a lot about actually physiological response, but more than just the physiological response, the integration and the association between mind and body when it turns to sexual arousal and sexual response. We also have a sex lab in our university, in Porto University, so if you want to, actually, if you want to know what we do, you can use this link and you will know exactly our studies, projects, and so forth. You use the equipment that you use to measure sexual arousal, actually physiological arousal. You use vaginal photoplethysmograph, which is this one. And what it measures is actually measures VPA, which is vaginal pulse amplitude. So if you have the vaginal pulse amplitude is high, it means that a woman is having sexual arousal physiologically. And also we measure penile circumference changes. So of course there's a more direct and obvious relation with the arousal in men. So what we do in our lab in terms of, and most people do in their labs in terms of measuring sexual arousal physiologically is using these two different measures. We also have other measures, and one very interesting measure is the eye tracking. I'm not sure if you are familiar with the eye tracking, but in our kind of studies it's very interesting because what we are looking for, actually we are looking for, as I told you before, the interrelation and the connection between mind and body. So the eye tracker, it helps you actually having the idea exactly on what is your visual attention. Of course, it doesn't measure cognitions and emotions, but it will tell you exactly where did you focus your attention during sexual stimuli, during a sexual film. So we use sexual films in the lab to elicit sexual arousal. And as you can see, this is a very soft film, let's put it this way. But we can actually see and measure what was the main focus of attention during the films. We can try to see if people were focusing on genitals, on the sexual interaction, on the face, or whatever. Or actually at the same time, in this study, we used kind of a feedback on sexual arousal. So at the same time, while people were watching the films, they will have also a graphic which showed their sexual arousal. This was not exactly the sexual arousal that they were having at that moment, so it was fake. But on the other hand, what we were trying to understand was, are there people looking more at the sexual stimuli, or are there people looking more or distracted by their own supposed own sexual response? So this is the kind of things that we can test in our lab. So to start with the question of concordance between genital arousal and subjective arousal. And as some of you may know, since the 80s, there's been consistent reporting on discordance, so discrepancy, mostly in women, between genital arousal and subjective arousal, which means that women, when they go to the lab and watch these sexual films, and afterwards we ask them to report the level of sexual arousal, actually the association or the correlation between the subjective, what they say that they felt in terms of arousal, is not completely concordant with their own sexual physiological response. So of course, we're not sure they're not red, so we're not, as Jim just said, they might be influenced by the experiment. We don't know. But actually, there's no other way to measure it unless asking them. And what about in men? This is very interesting because there's not a lot of literature on discordance in men. So it's kind of, this is a female question. This is a female issue, not a male issue. But when we look at the literature, actually, although concordance in men is higher than concordance in women, actually, a literature review says that in average, the correlation between subjective and physiological arousal in men is no more than 0.6. Of course, 0.6 in a correlation is always statistically significant, but it's far from an ideal correlation. So there's a lot of room for discordance also in men. And actually, in a very recent study, which was published last year in JSM, we found in our sample the correlation of 0.27. So at least in our study, discordance was also high in men. So what is happening? Is this the body disconnected from the mind? What is happening? Are these two separate or actually separate to some extent? So if you go to clinical, so I'm a clinical psychologist, so I started my interest started with clinical aspects and clinical questions. So if you are clinical, you will know that, for instance, women who go to ask for help, in terms of sex therapy, not probably in terms of gynecology, but when they come for help and ask for help with sexual problems and go to a sex therapist, it's very rare to find a woman who says, my main complaint is lack of lubrication. And actually, most women who ask for help, they complain about I have less desire than I would like to have, than I had in the past, and I don't have pleasure with sex, and I have difficulty getting orgasm. So these three things may come together or not, but it's very, very common to come together. But usually lubrication it's a part of that. So most women who ask for help, difficulty having pleasure, difficulty having desire, but they usually are able to lubricate. So what is happening with these women? DSM-IV, interestingly, proposed a new category. So it's changed actually dramatically from DSM-IV in women, as you may know. So now, what used to be sexual arousal disorder in women, which was actually only, the only marker was a physiological marker, so absence of lubrication or difficult getting lubricated. That was the main criteria for sexual arousal disorder in women. And now, lubrication actually was excluded from the new criteria. And actually, arousal or subjective arousal became close together with desire. So the new DSM-V is proposing interest/desire, or actually interest/arousal disorders, and the markers, so the symptoms are mostly subjective. So there's almost no objective, or let's say physiological marker or symptom in the new criteria. So there was a major change. But in men, this DSM-IV is almost unchanged. So there's still hypoactive sexual desire on one end, and there's still erectile disorder on the other end. So for the first time, the DSM-IV changed dramatically in terms of analogy between men and women. So why was that? I mean, one interesting thing is that a major difference in men and women regarding this? What we did actually a study which was published in 2011, two studies actually, and we look at patterns of overlapping between dimensions of sexual response. So I will try to do this quickly. The sample was a big sample. You use IIEF and the FSFI to measure the different dimensions of sexual response or functioning. And we did exploratory factor analysis and confirmatory factor analysis to see to compare different models, to see what is the best solution to explain the differences or to explain the differences between men and women. So what we did in men, actually, you can see here two different models. On the right end, you will see the model that best fits for men without sexual difficulties, so healthy men, and for men with sexual difficulties. And actually, the best model was different. So as you can see, for men without sexual difficulties, the desire domain is independent from the erectile, but on the other end, the erection and the orgasm domain came together in one single dimension, which is also interesting. It might be the fact, it might be related to how the items of erection and orgasm are assessed in the IIEF. We don't know, of course, about that, but it's interesting that they came together. And on the other end, we used also additional items assessing premature ejaculation, which is not assessed originally by the IIEF. But it turned out that this is completely independent from the other one. But what is interesting here is on men with sexual difficulties. What happened here is that desire, erection, and orgasm, they are very close together. So people who, let's say they have low desire, they tend to have low erection and low orgasm and so forth. So it seems that in men with sexual difficulties, these three dimensions are very close together, or at least the way they responded to these three dimensions or items related to them are very close together. Interestingly, in women, the overlap is not that much clear. So we used to say, or people tend to say that women are, so domains are much more connected with each other and men are much more separated, but in this particular study, it was not exactly that what happened. So if you look at here, in women without sexual problems, desire, arousal, subjective arousal, let's put it this way, lubrication, orgasm, they are all independent from each other. And actually pain and vaginismus, we added an item on vaginismus, they correlate with each other very strongly, so they load in one factor. But when it goes to clinical, so women with sexual difficulties, you can see very interesting that desire and subjective arousal, they go together, as in the DSM-V, actually. But lubrication still isolated. So it's a different dimension. Lubrication is, at least in this study, independent from desire and subjective arousal who go together. And again, orgasm and then pain and vaginismus. So it's, again, interesting that physiological components, or at least lubrication, self-reported lubrication, goes independent from subjective arousal and desire. Do I still have 3 or 4 minutes, Andre? Okay. So next, I'm going to present you studies on predictors of subjective arousal and predictors of physiological arousal. The question was, so again, my most interest is in psychological aspects. So what I tend to do is to study cognitions and emotions. And again, we have to ask people for their cognitions and their emotions. So it's self-reported cognitions and emotions during sexual, in this case, not during sexual activity, but during exposure to sexual stimuli in the lab. So what we ask them is to to check a list, using a Likert scale, a list of cognitions, which some of them are related to sexual thoughts, and others are related to distractive or negative thoughts. So I'm not sure if you're familiar with Barlow's model, actually, who says that the main difference between people with sexual dysfunction and without sexual dysfunction is the cognitive and affective response. So if they are distracted, they will, and if distraction is negative, so the cognitions are negative and emotions are negative, that will have a major impact on sexual response. And otherwise, if you are focused on erotic thoughts, focused on erotic stimuli, and have positive emotions, then your sexual arousal will be higher. So we try to see how these positive and negative emotions and how these sexual thoughts versus distractive and negative thoughts will have an impact on sexual arousal, either by measured physiologically or measured cognitively by asking them how pleasure did they have during the experiment. So what we see here is regression analysis. So first, in women, this was published actually last year in Journal of Sexual Medicine, and actually the thoughts predicted subjective sexual arousal in women, and as you can see, the beta is very high and explain 74% of the variance. So it's a very high explained variance here. And what you can see is it's mostly the erotic thoughts that predict subjective sexual arousal in a positive way, which was expected, not the negative thoughts. But remember, this was made with women without sexual problems, so sexually healthy women. So let's put it this way, erotic thoughts predict, in a large amount, subjective sexual arousal. And also positive affect. So you can see very similar. Positive affect, so positive emotions during the exposure to the films predict, in a large amount, subjective sexual arousal after the film or during the film. But interestingly, when we look at predictors of physiological arousal in women, none of them actually were significant predictors of physiological arousal. So in other words, self-reported cognitions, either they were sexual thoughts, erotic thoughts, or distractive and negative thoughts, they did not predict genital arousal. And affect the same. Either you had positive emotions or negative emotions, they did not predict physiological sexual arousal in women. And what about men? Very similar pattern. So, as you can see again, erotic thoughts were clearly the best predictor of subjective arousal in men. Although the variance, explained variance is a little bit lower, so 37%, still it's statistically significant. And exactly the same pattern for emotions. So positive emotions are significant predictors of subjective arousal. But again, when you look at predictors of physiological arousal, actually emotions or affect do not predict at all sexual arousal, physiological sexual arousal, but actually, on the other hand, distractive thoughts, they do predict sexual arousal physiologically. So it seems there is a different, actually, on one hand, these cognitions and emotions seems to predict very well subjective arousal. They do not predict very well physiological arousal. The only difference is in men, and it's in the opposite way. It means that distractive thoughts, to some extent, do predict negative sexual arousal in men. So this is interesting in terms of also clinical implications. So we may say that sexual thoughts and positive emotions may enhance, of course, subjective arousal, both in men and women. And what is the clinical implication for this? We know that for instance, I'm not sure if you are familiar, one of the most known psychotherapies is cognitive behavior therapy. So cognitive behavior therapy, actually, the main goal of cognitive behavior therapy is to change cognitions. And while changing cognitions, also changing emotions, and ultimately will lead to changes in behaviors, and in this case, also possibly in sexual response. So this is also, I would say that one major point, that cognitive behavioral therapy may be useful, because if you change cognitions and emotions, you may change at least subjective sexual arousal. On the other hand, there's mindfulness, which is also, it's not linked to changing cognitions, but it actually changes cognition through a different path, because it will, the main, I would say, goal of mindfulness is to be aware of the moment. So if you are aware of the moment, if the moment is pleasurable, then you may have more positive emotions and, of course, sexual thoughts and so forth. And to finalize, I would say that we are now doing, moving to clinical implications, we are now doing one randomized control trial study comparing cognitive behavioral therapy with PDE5 inhibitors in the treatment of erectile dysfunction. So we only have preliminary data at this point. I'm not going to present those data, but just to let you know that the implications of this may be translated to clinical, and we hope that we can do that and to test more of these, both in men and in women, not only with erectile problems, with desire problems and arousal problems and so forth. Grazie tanti.